Hey there, Dr. Luke here, and we're all about healthy joints. Today, it is our knee joint. We want to work with our external rotation, pails and rails for this knee. Our base for this one is seated, bringing our hand on the medial side of our foot so we introduce our external rotation of our knee. I like to bring my hand underneath into this position here, just above the elbow, and then that allows me to really put pressure on that ankle to induce that external rotation of my tibia. Really try and focus that stretch through that tibia, not the ankle. So dorsiflex that ankle up and try and get the best possible stretch to that knee joint and joint capsule. So what we want to do now is we want to start our timer. So we want to do 2 minutes in this position ideally, and do our breathing, diaphragmatic breathing. We want to breathe in and out. Breathe in as much as we can and breathe out as much as we can. Really focus on that knee joint. Okay, let's go through our pails and rails. So our first contraction is going to be pushing against my hand, and we're going to do that best effort for about 15 seconds. Now, if you're feeling any pain or discomfort in this, we certainly only want to be in the pain-free range, and you be the coach with the contraction of this Pails contraction, making sure that it's a safe contraction and your body's ready for it. But we want to build up to that best effort. So our Pails contraction is going to be pushing into our hand, so that contraction is going to be looking like this. We want to focus the contraction on our internal rotation there. So we're going to be contracting the hamstring on this side to bring our tibia into that internal rotation. Our rails contraction is going to be the opposite contraction, where we're going to be doing external rotation. That's going to be going this way, externally rotating. So let's go for 2 minutes. So holding, 3, 2, 1, and contract. So I'm trying to externally rotate that tibia. 15 seconds, keep going, keep going. 3, 2, 1, and now the opposite contraction now. I'm trying to bring this foot into the floor there, pulling it away from my hand. Keep going, switching on all the muscles to externally rotate that tibia and relax. And now we bring it to the new stretch. Make sure you're dorsiflexing that ankle. You're getting the best possible external rotation there. So that's great. Now we do a 45-second stretch. So with the pails and rails, just making sure that you're really focusing on that tibia, external and internal rotation. Good. Three, 2, 1, Pails contraction into my hand, really switching on that hamstring, that medial hamstring, to rotate that tibia. Really focus on the knee rotation, not the ankle rotation. Just focus on all the muscles. 3, 2, 1, and opposite contraction. We're trying to externally rotate that foot. So we're trying to pull away from our hand. Really contract. 3, 2, 1, and relax. Fantastic. Find a new stretch for that knee. This is another 45-second stretch here. Fantastic. This is going to help us with our goal to be better at our CARs, our controlled articular rotation, and that allows us to have healthy movement there. 3, oh, another 15 seconds, sorry. Another 5 seconds. 3, 2, 1, and slowly come out of that base. Fantastic. Now we want to end our base. If we do different types of bases for the knee, we always want to end with our controlled articular rotations and our capsular CARs there, so don't forget that, and give this one a go. This is a Pails and rails for our knee in that external rotation position. Give that a go.